I was a medical officer specialist working in District Ayurveda Hospital during the period of not last, 2010 Commonwealth Games. Before that, I was not so focusing on sports Ayurveda, but I used to get a lot of cases as I was in Marma practitioner. A lot of orthopedic conditions were coming to the District Ayurveda Hospital. So the available, that if 100 cases are coming, 10 were from the nearby sports schools and the sports academies like that one. So I used to observe that sports person needs some care, especially at least injury management. So that was a time, 2010. There was no, in the department, there was no sports Ayurveda, no sports medicine, no platform for sports medicine. So at that time, he was the beginner. He was the founder, actually, Dr. Arshad. I'm very happy that he has presented a very good part in the initial session itself. He is the founder, actually. He was, after passing the graduation, he went for a diploma course in the sports medicine, and he started his career with the sports person itself. That was an inspiration for me also. As I was from the Kottakkal Ayurveda College, he also belongs to the same academy. So in that time, next one. Mr. Sajeesh Joseph, who was planning for a Commonwealth game, 800 meters. Prija Sridharan, Prajusha, and the pole vault, Bimin, all these people were, they were in that very same batch who was preparing, they were preparing for the 2010 Commonwealth Games. These people came to Munnar, our high altitude center, for training. While training going on in Munnar high altitude center, this guy had an injury. See, some person called me, is there any remedy in Ayurveda for this guy? He is preparing for the Commonwealth and he will be attending the Commonwealth in the 5th day. So we have only 5 days. See, he approached our hospital and we were having a lot of difficulties. There was no pay ward. There was, the wards were full, as doctors were there. They were having very good IP, and I was not able to accommodate any sports person at that time. Anyway, we made a try. So the 5 days, he had severe pain. Minimum period for treatment, 5 days were left. High expectation from the patient. He was having a very good career record before going to the high altitude center. He was a top one in the 800 at that time. Needs rehabilitation before the event. No scope for medication. As at that time, the doping was very strict. Say, a lot of athletes were excluded from our team of India with the doping, as if they were kept in abandoned for 5 years or 10 years, like that one. So he was a very genuine person, and he wanted to, even a Vettumaran was not allowed. A Dhanvandaran Guliga not allowed. So this was a situation. So pain you have to manage the pain. Minimum period was there. High expectation from the patient, needs rehabilitation. So you can imagine even now the situation of ISM hospitals. Even now, if you are admitting a patient, you have to get a care, you have to wait for days and days, like that one. That may not be possible for a sports person. That was the first challenge we were facing. Anyway, we took the challenge. And this was the sloka which helped me. That was a sutra behind treating that sports person and obtaining that target. Yeah, we admitted him. Mr. Sajesh was admitted at the limited facility of District Ayurveda Hospital, Todupuzha. And we did according to that sutra. A dhara was given, not taila, dhanyamla dhara. Then and Upanaha was available drugs with the maximum potentiated things. We did for 2-3 days. And the finally, we did an Agni Karma. And the fourth day, he went to the nearest college ground. We were not having a ground for practice. He started practice in the early morning, and at noon, he told me that, doctor, there is no pain so far. Let me see. He went to Commonwealth game and he won with the gold medal with records. How do you say? This was a challenging and very great inspiration for all of us in that team who were in the sports department of District Ayurveda Hospital. Nurses were there, attendants were there. All of them helped me to achieve this target. And he win with the goal with a record of 46.86 seconds, a meet record that erased the old mark of Gamandaram, an Indian itself. That was a milestone for Ayurveda sports medicine as far as government Ayurveda hospital was concerned. After that, around 6,000 patients, right from school level to academies and even Sai Sports Center, right from the Punjab to Trivandrum, came to Todupuzha for treatment. We treated almost 6,000 patients as outpatients and 1,800 patients as inpatient. So that was a very good start for a small specialty. And the department gave us tremendous support. And even these are the two Olympians attended. One with the Mr. Long jump winner, and then other one is who was participating for the 400 relay team. A lot of sports persons, national, international level sports persons came to us, and we treated, and we could do a little bit, at least injury management. As you all know that, as Dr. Sheila was presenting the paper, it's a broad, vivid area. Injury management, it's a very small portion. And a lot of things are there. Sports psychology, sports nutrition is there, injury prevention methods are there, sports psychology is there. A lot of things can be done right from Ayurvedic side to help the sports person to win the game. So that was a very good thing. And I just wanted to share this thing because it is a time of Commonwealth Games. And 2010, we started the program. And in 2020, now it's having a hospital in Thrissur and having treatment given to sports person exclusively. So during that period, this was a statistics of patients came there, and most of them were from athletics. And next, we will pass on to my own subject, which is allowed to me. This is repetitive strain injuries. It's a special reference to sports person. As you all know that trauma is having three diversions. One, direct trauma. Second one is indirect. And third one is my subject, repetitive strain injuries. As you all know that sports persons, while from their practice, their event, and in their entire period of time, they'll be subjected to repetitive strain injuries, maybe to the elbow, to the knee, to the hip, to ankle, entire way. See, you can see our little master is batting with a heavy bat. He is giving repeated extension activities. See how much time he must have done his extension activities. You cannot imagine, you cannot count. So that can injure the lateral epicondyle, the extensor muscle, which is connecting to the lateral epicondyle, which will be subjected to a non-specific inflammation, which we call it as tennis elbow. There's a right example for repetitive strain injury. So repetitive strain injury is very, very, very common in almost all the sports persons. Next one. It can manifest right from skin to bone. A repetitive strain can injure the tissues right from skin to bone. At the level of the skin, it can be a blister, bursitis, muscle tears, muscle hernia, tendon tendinitis, rupture endoesophagus, ligament can be a strain and a full strain or a partial strain with instability. Joint, it can go for a synovitis, capsulitis, and at the level of bone, there can be stress fractures also. So right from skin to bone, there is chance for repetitive strain injuries. Next. So these are the mechanisms which culminate in sports injuries. Too much, too quickly, too heavy, inadequate warm up. See, nowadays the sports persons are getting some information how to warm up, how to go for matches, how to warm down, how to go for rehabilitation, such things. So 10 years back, there was no guidance for the sports persons. Even now in our country, sports persons are not getting proper training, proper information regarding their not only for the nutritional activities, their activities, their prevention of injury issues, etc., etc. Poor equipments, incorrect surface, poor techniques, mechanical imbalance, previous injury. That's a major thing. They may not treat for an injury, which will be again subjected to repeated strain and will go for a major injury like ligament tear, ligament partial or complete tear, or a tendon injury like that one. Poor healing, competitive pressures. So these are the mechanism of repetitive strain injuries. In another way, whereas most of the injuries are obvious and direct due to overuse, that's why they call it as sporting injuries without adequate training. Too much, too soon, too fast. This is the mechanism of repetitive strain injury. There is another term, overuse injury also, cumulative stress injury also. Some texts, they say that it's a cumulative stress injury. Pain and inflammation in the soft tissue components of the locomotor system, tendon, ligaments, capsule, fascia, etc. are common in all age groups and represent the result of minor, often repetitive trauma or overuse. Commonest RSI. At the level of each tissue, you can say at the level of a muscle, it can be an extrinsic lesion or an intrinsic lesion. We just compare it with the intrinsic lesion as well as extrinsic lesion. I'm not going into details about that one. Tendon, it can be a complete or a partial rupture or a tendinitis or an enthesopathy. So at the level of tendon itself, there can be a partial injury or a full injury or a enthesopathy, cumulative stress which results in an enthesopathy. Yeah. Next one, at the level of ligament, as you all know that ligament are the structures which give stability to the joint. So ligament damage is always a result of sudden trauma. So it can go for a instability and finally the joint may damage. So the most commonest ligament injury is medial collateral ligament injury of the knee joint. There are a lot of injuries also. Footballers are most subjected to ACL tear. According to sports event, there are areas which subjected to more stress and injuries. Next one. So as far as a joint is concerned, it can be a synovitis or a capsulitis. Next one. At the level of bone, commonest lower limb pelvis, this is a stress fracture, which is a normal, yet you can see a lot of patients, even not sports person, those who are going to Sabarimala after 1 or 2 or 3 days, they may come with a swelling in the foot. And if you're taking an X-ray, foot oblique view, you can see a small hairline, fifth metatarsal base or something like metatarsal, second metatarsal base. So this is very evident in most of the OPs. OPDs-le sports person-e കാണുന്നവർ എത്ര പേരുണ്ട്? സ്പോർട്സ് പേഴ്സണെ കാണുന്നവരുണ്ട്, ഉറപ്പായിട്ടുണ്ട്. I think so. Not formally, informally, persons are coming for a treatment, Ayurvedic treatment nowadays. അതാ ഞാൻ പറഞ്ഞ ആദ്യം ഞാൻ ട്രീറ്റ് ചെയ്തപ്പോൾ ഒഫീഷ്യലി ആയിട്ടല്ല ചെയ്തിരുന്നത്, എങ്കിൽ പോലും ഒരു 10% സ്പോർട്സ് പേഴ്സൺസ് നമ്മുടെ അടുത്ത് വരുന്നുണ്ടാവാം unofficially. Now it has become a branch and you can treat with a more confidence, with the more this type of proven papers and like that one. So these are the areas which are more commonly liable for stress fractures and commonly occurring some specific repeated strain injuries. One is carpal tunnel syndrome. As you all know that the medial nerve is being subjected to severe inflammatory component or a carpal tunnel compression, which results in numbness or pain of the ulnar nerve area. So that will result in advanced cases, it can go for, you have to rule out cervical spondylosis, and EMG is confirmatory. In advanced cases, there can be thenar or hypothenar muscle weakness. In sports persons, you will get initial level, that the painful numbness stage, you will get it. And another one is a lateral epicondylitis, which we call it as tennis elbow. It's very common. It's a non-specific inflammatory condition of the lateral epicondyle. Tennis or other racket sports items which can cause these type of injuries. Next one. Symptoms. As you all know that you can, from your academy itself, you will be getting a lot of information regarding how to examine a case of elbow and ask the patient to clinch the feet. They will say that pain is here. And ask the patient to, you just put a thumb here and ask the patient to again put the press. Patient will say that patient will not be having that much of pain. That means you have blocked the extensor muscles. In the OPD itself, you can confirm the diagnosis without too much investigations, and you can go for the treatment. Right. You have to rule out C7 neuropathy. That's one. So just opposite medial epicondylitis, which we call it as golfer's elbow, which is very common in weight bearers and wrestlers, and like that one, archers, weightlifters. And symptoms are very similar, but it will be prominent in the medial epicondyle, and the flexors are the main causes. Too much strain of the flexors of the forearm are the cause for a repeated strain of the golfer's injury. Next one. And shoulder. As you all know, the rotator cuff stress is very, very common in not only cricketers, basketballers. A lot of sports persons are coming with this shoulder injuries, which we call it as supraspinatus, infraspinatus, teres-minor, subscapularis. Apart from these things, there can be bursitis also. Bicipital tendinitis, subacromial bursitis, subcoracoid bursitis, and if not getting treated in the right time, it can go for periarthritis and chronicity, which leads to frozen shoulder. Next. And this is very common in jumpers, hurdlers, iliotibial band syndromes, and walkers. Very, very common. And the thing is, the ITB runs along the length of the thigh. IT band is a thick band which fascia on the lateral aspect of the knee, extending from the outside of the pelvis over the hip and knee, inserting just below the knee, stabilizes the knee. Ask the patient to stay like this. Patient will say that there's a tightening of the fiber. Confirmatory sign with iliotibial band syndrome, which is very, very common in sports person. But you have to rule out LCL tear, chondromalacia patella, patellofemoral syndromes. So this is the sharp pain, burning sense above the outer part of the knee. Pain worsens with the continuance of the running or the other repetitive activities. Swelling of the outer side of the knee. Pain during early knee bending. That's very, very common. But you have to rule out these things. Patellofemoral syndrome, chondromalacia patella, LCL tear, and also in adolescent period, which is we will next one. Patellar tendinitis is very common in jumpers and hurdlers and like that events, and basketballers, volleyballers. Very common. Injury to the patellar tendon leads to pain and inflammation, which we call it as jumper's knee. Commonly occurs in athletes who are involved in jumping sports such as basketball, volleyball, but can affect any athlete. But here you have to rule out. In most of the sports person, they may be coming from the school level. Adolescent period, you have to rule out. Or was good slatters. What is slatters? It is primarily seen in adolescent boys. The tibial tubercle is not fixed. So repeated extension, which can create pressure on the tibial tubercle, and it will be slightly avulsed, which with a swelling, the patient will be coming. There will be a prominence in the tibial tubercle. So that is something different from patellar tendinitis. So that is a usual thing, usually seen in the adolescent, mostly boys, where you have to immobilize that particular part with the patellar support. And in patellar tendinitis, the treatment protocol is Upanaha, like that one. But if it is a case of Schlatter's disease, there is no point in giving too much medicine just to arrest the movement of the patellar quadriceps tendon, which is attaching to the tibial tubercle, with the help of a small band, which we call it as patellar support. Have you seen that one? Patellar support? Nobody is reacting. School going children, adults, it's mostly boys. Long jump, focus on the practice on the focus. പിന്നെ നമ്മുടെ ഗ്രൗണ്ട്സ് ഒക്കെ അൺഈവൻ പ്രോപ്പർ ഒന്നുമല്ല. അപ്പൊ അങ്ങനെ വരുമ്പോൾ റിപ്പീറ്റഡ് സ്ട്രെയിൻ വന്ന് ചെറിയ സ്വെല്ലിംഗ് വന്ന് ഈ ടിബിയൽ ട്യൂബറുകൾ അവൾസ് ചെയ്യും. അവിടെ ചെറിയൊരു സ്വെല്ലിങ്ങോട് കൂടി നീരോട് കൂടി പേഷ്യന്റ് വരും. അപ്പൊ നിങ്ങൾ ചെയ്യേണ്ടത് ഒരു ടോട്ടൽ നീ ഫുൾ ആയിട്ട് സപ്പോർട്ട് ചെയ്യണ്ട, ആ ടിബിയൽ ട്യൂബർക്കിളിനെ മാത്രം സപ്പോർട്ട് ചെയ്യാനായിട്ട്, ജസ്റ്റ് ലൈക്ക് യു ആർ ഗിവിംഗ് എ ടെന്നിസ് എൽബോ സപ്പോർട്ട്, ദർ ഈസ് എ പാറ്റലർ സപ്പോർട്ട് വിച്ച് ക്യാൻ ബി വെരി simply applied for that patient and give some labor and ask the patient to give for rest for 1 or 2 weeks and rehabilitation gradually. This is very important thing. Next one, shin splint, very common during the very powerful matches, very powerful games. Shin splint, which defines as the pain along the inner edge of the tibia. Overpronation is a common factor which results in a severe pain of the shin bone, usually seen in the very sprinters, usually seen. Next one, retrocalcaneal bursitis, which very commonly seen in walkers. Because why? Walking, you have to put the heel on the floor and you have to accelerate. So there will be a load on the tendocalcaneum, which is attaching to the calcaneum. So that area is getting overused. And to prevent that friction, there is a bursa, which usually getting pressure and inflamed. So that is called the retrocalcaneal bursitis. You can see this is a. So you have to rule out Achilles tendinitis. This is something very different from tendinitis. This is bursitis. So bursitis and tendinitis, you have to treat in 2 lines. Like and Mars fracture, very common in athletes and sprint events, long races, and especially our grounds are not so good. So there is chance for repeated strain of the foot. So fatigue or so you have to rule out metatarsalgia. A digital X-ray will be very powerful. A powerful digital X-ray will be excluding the possibility of a bony lesion. And if it is not getting, go for a CT. Very rarely needed. And these are the basic pathology behind this thing: friction, stress, ischemia. Basically, these are the 3 factors operating in repeated strain injuries. I'm not going into details about that one. Time is very limited. So diagnosis is very, very important. So in not only in any disease, you have to examine properly. The history is very, very important. As of course, how the patient fell down, how was his practice since last 7 days or like that one, what is his event, what is his nutritional status, all these things you have to take into consideration, and you have to accurately diagnose the sports person. Otherwise, you may make mistakes. So just like കാടം വെടി വെക്കാൻ പറ്റില്ല, you have to pinpoint. You have to pinpoint and then operate. Then only you will get the focused action. It's very, very important. So for that, clinical examination is very, very, very important. More than imageology, clinical examination is the basic thing in sports medicine. To examine the patient in full swing. I seen from the YouTube channel, Dr. Arshad was narrating, you have to unstrip the patient and examine in full swing. If it is a spinal pathology, it's sure. What he said was absolutely right. You are not, nowadays we are not, most of the newcomers, they are hesitating to do the clinical examination. If you are properly examining, there is no need for higher investigations. Only simple investigations will guide you, like an X-ray or ultrasound. That will be sufficient for most of the lesions. MRI is not at all needed in all the cases. See, nowadays the trend is to investigate maximum and examine minimum. If you are a sports physician, the thing should be reversed. You have to examine properly. You have to give more time for examination and less time for investigating. That is the key, right? And as a part of the generalized disease, there can be soft tissue lesions and this type of repetitive strain injuries. If a tennis elbow or a golfer's elbow or a tendinitis or something is coming, you have to rule out the possibility of a systemic diseases which causing tendinitis or ligament injuries. Polymyalgia rheumatica, early phase of RA, SLD, viral infections, bacterial osteoarthritis, endocrine disease, osteomalacia, Pediatric disease, malignancy, akinetic phase of Parkinsonism, fibrositis, psychogenic rheumatism. So you have to rule out all these things. And finally, you have to investigate minimally and arrive at a professional diagnosis and go for the treatment. Next one. Treatment should start within 48 hours. That is a major key rule in sports medicine. And it is applicable to Ayurveda also. Do you think that this protocol should be changed? Treatment before 48 hours and treatment after 48 hours. It has come from evaluation since centuries. It is absolutely right. 48 hours and after 48 hours, the treatment protocol is entirely different, not only in modern medicine, Ayurveda also. Initially, you may have to go for Sithopacharas like that one, bandage, such things, labors, such things are very, very important. And after 48 hours or 2-3 days, the thing is different. So in Ayurveda also, the thing is different. So rest, ice packs, compression, elevation, non-steroidal anti-inflammatory. You might have seen in the morning class. Okay, next one. The role of heat is coming after 48 hours only. And physiotherapy exercise programs are highly relevant in sports person. Next one. And coming to Ayurveda protocols, before going to the Ayurveda protocol, how we are arriving at a conclusion, how to treat a repeated strain injury, this is very important. Marma, Abhigada, Samanya Lakshana, which you will be very familiar as you are coming from the academy. And you just go through just something Marma Viddha Lakshana, intense pain, limping, reduced range of movement, reduced power, reduced muscle bulk, joint swelling. This is very relevant in almost any joint injury. This is very important. Only these things are very coming in most of the conditions. So you have to interpret in terms of our own methodology. Next one. And this is my conclusion regarding how to treat before treating a RSI. This will be the etiopathogenesis of Marma Bhigada. Yeah. So the line of treatment which I adopt for repetitive strain injuries is derived from 4 components. One is Marmabhigata Chikilsa, and next one is Uttana Vadarakta Chikilsa, and 3 Bhagna Chikilsa, and 4 Snayu Sandhigata Vada Chikilsa. These 4 things attribute to the line of treatment for repetitive strain injuries in sports persons. Next one. So, Marmabhiga, what is Marmabhigata Chikilsa? This is a very, very, very vague thing as far as no academy is giving a protocol regarding what is Marmabhigata Chikilsa. So, this should evolve from seminars like this one and continuous efforts. And I think Dr. Sudhikumar is trying very hard to get into touch with the academy to promote sports medicine, to go for MPhil courses and diploma courses. And I think there will be a good discussions and there will be a lot of theoretical and practical things adapted. And I think we can evolve within 1 or 2 years. I hope so. So Marmabhigata Chikitsa, generally Marma stimulation techniques are highly specific according to the physician, just like chiropractics. Chiropractics, there are a lot of schools. Vadakan Karali, Tekkakalari എന്ന് പറയുന്ന പോലെ തന്നെ Marmabhigata techniques used for pain management and initial range of movement improvement. These things are highly specific, and lot of labors. Dr. Sheila was telling a lot of things, so which can be included in labors, Shiradhara, Thailadhara, which can be used for Marmabhigata Chikitsa as a part. Uttana Vadarakta Chikitsa, as you all know that, superficial. See, most of these soft tissue injuries leads to superficial manifestation. So go for Lebana Abhyanga Parisheka Avagaha. This is very, very relevant. And apart from the classical line of management of the following modalities, also found helpful. Puttapaga Lepam, some special Marma Lepas run in some families, which is to be evaluated in terms of pharmacology, which is found very effective. Pushmasveda, pressure bandages, Jalavugavajarna, and even Agnikarma is also useful in management. Right. And Bhagna, as you all know that this is the line of management. Next. So, Snayu Sandhigata Vada Chikitsa, which is the key, which give me an entrance into sports medicine, and very obliged to Lord Vagbada, Acharya Vagbada, and this is very, very convincing. And this is a very useful tool for treating most of the conditions. Next one. And as you all know that as a prophylactic conditions, role of Dinacharya, role of the Rituracharya yoga is very, very relevant. Next one. Types of injuries, including fitness improvement programs reported during that period. I told you that 5 to 7 years of my service, this was the result. And traditionally used, I will just show you some traditionally used herbs in the management of Marma practices in especially sports medicine. Pavata, Sringala, Vallikanjiram, Tardaval, Veliperthi, Chadiramulla, Ujinya, Ella. ഇത് വളരെ കീ റോളിൽ ഉപയോഗിക്കാൻ പറ്റുന്ന ചില നമുക്ക് കേരളത്തിൽ അവൈലബിൾ ആയിട്ടുള്ള കുറച്ച് പൊട്ടൻഷ്യൽ ഡ്രഗ്സ് ആണ്, വിച്ച് ക്യാൻ ബി യൂസ്ഡ് ആസ് ലോക്കൽ ആപ്ലിക്കേഷൻ, ആസ് എൻ അഡ്ജുവന്റ്. സം ആർ ഫോർ ഇന്റേണൽ ആപ്ലിക്കേഷൻ, എസ്പെഷ്യലി തിലം ഇസ് വെരി ഗുഡ് to improve the fitness improvement for sports person and for healing in most of the soft tissues. Tila is highly valuable and very cheaply available, and genuinely it can be administered. That's why Gandhadailam, I think it is working well. And of course, as you all know that our Muruvanna is doing a fantastic job, which can be used as a cold Muruvanna pack or warm Muruvanna, or according to your condition which require. If it is a case of within 48 hours, I used to put cold Muruvanna packs. After 3 to 4 days, we can use Muruvanna as such. So according to the situation, you can treat. You can consider Muruvenna as also a basic tool. So this is very important. Here my juniors. So make it a habit. Observe any elder physician treating, just like anybody from Malappuram district. Yeah, they have a very good platform there, as Dr. Arshad and Samir are there. So interact with them. When you get a case, just discuss with them and make a protocol and treat it. Then you will be successful. And here also in the southern area, anybody from Trivandrum, Kollam, Dr. Jayan Suresh, Dr. Sajeev, all these things are, they're all my seniors. So make a habit that observe, learn, practice, develop skill. Develop skill. That is very, very important, especially examining a patient. How gently he can examine the patient. So images are images only. Don't treat images. നിഴലിനെ ചികിത്സിക്കാതെ നിജത്തെ ചികിത്സിക്കണം. അങ്ങനെ കേട്ടിട്ടുണ്ടോ? See, a lot of, I saw that Dr. Arshad was presenting a lot of cases with heavy investigations. See, you can treat it. Conservative management. Now the modern medicine, they are rejecting conservative management. So that we have a very good role in conservative management, especially soft tissues. And bony lesions may not be possible for a youngster, but you can treat soft tissue lesions in a very good manner, conservatively, without going for surgical management. You can treat even shoulder injuries, minor grade 1 to 2 ligament injuries, tendinitis, tendon injuries, bursitis, all these things you can treat well and develop your skill, interact with the parallel medical school. This is very, very important. കൂവസ്ഥ മണ്ഡൂകങ്ങളാവരുത്. Parallel branches consider. See, doctor is here. He is from a modern pharmaceutical level. So, അദ്ദേഹത്തെ കൂട്ടിക്കൊണ്ട് ഡോക്ടർ ഷീലയ്ക്ക് ചെയ്യാൻ പറ്റിയ ഒരുപാട് കാര്യങ്ങളുണ്ട്. So, if you can interact with the parallel medical school, I don't mean that a modern medical doctor also is helpful. ഇമേജോളജിയിലൊക്കെ നമുക്ക് ഒരുപാട് ഹെൽപ്പ് ചെയ്യാൻ പറ്റും. പക്ഷെ നല്ലൊരു പ്രാക്ടീഷണർ ആവുക എന്നുള്ളത് വളരെ ഒരു അംബീഷ്യസ് ആയിട്ട് നിന്നാല് interact with the parallel, all the relevant things, active things, which can contribute to your treatment, not only in treatment but diagnosis also, and treating with the medicines with the very patient friendly approach way. ഈ സ്പോർട്സ് പേഴ്സണെ ട്രീറ്റ് ചെയ്യുമ്പോൾ ഉണ്ടായിട്ടുള്ള ഒരു ദുരനുഭവം പറയാം. ആയുർവേദക്കാർ മാത്രമുള്ള ഒരു സദസ്സിലായിട്ട് ഇത് പറയാം. അത് വിഷമം തോന്നരുത്. സ്പോർട്സ് പേഴ്സണെ ട്രീറ്റ് ചെയ്യുമ്പോൾ അവർക്ക് ഒരിക്കലും വാമപ്പ് എക്സസൈസ് കാര്യങ്ങളൊന്നും ഇടയ്ക്ക് മുടക്കാൻ പറ്റില്ല. മുടക്കി അവരുടെ കരിയർ പോയി. അപ്പൊ നമ്മളൊരു വാർഡിൽ ട്രീറ്റ് ചെയ്തിട്ട് മറ്റു രോഗികളെ ചികിത്സിക്കുന്ന പോലെ കയറി കിടന്ന് 55ാമത്തെ ദിവസം നിന്നെ വിടാന്ന് വിചാരിച്ചാൽ സംഭവം പോയി. ഇറ്റ് ഷുഡ് ബി ഫോക്കസ്ഡ്, ഫാസ്റ്റ് ആയിരിക്കണം. അവർക്ക് ഫ്രണ്ട്ലി ആയിട്ടുള്ള മെഡിസിൻസ് ഏറ്റവും ഭംഗിയായിട്ട് കൊടുക്കാൻ നമുക്ക് ഇന്ന് ഫാർമസ്യൂട്ടിക്കൽ ടെക്നിക്സ് ഉണ്ട്. ഒരുപാട് പാരലൽ ബ്രാഞ്ചസ് നമുക്ക് ഒരുപാട് ഒബ്സർവ് ചെയ്യാൻ പറ്റും. മയോഫേഷ്യൽ റിലീസ്, ട്രിഗർ പോയിന്റ് റിലീസ്, ഓൾ ദീസ് തിങ്സ് യു ഹാവ് ടു അഡാപ്റ്റ്. ഫിസിയോതെറാപ്പി ഈസ് നത്തിങ്. മോഡേൺ ഫിസിയോതെറാപ്പി എന്ന് പറഞ്ഞാൽ ഇലക്ട്രോ തെറാപ്പി ആയിട്ടാണ് ചിലർ കാണുന്നത്. ഇറ്റ് ഈസ് നോട്ട് ഫിസിയോതെറാപ്പി. ഫിസിയോതെറാപ്പി ഈസ് നത്തിങ് ബട്ട് myofascial release, trigger point release, gait management, muscle imbalance correction. All these things are coming in modern physiotherapy techniques. So, നിങ്ങൾ ഒന്നിലെ പഠിക്കുക, അല്ലെങ്കിൽ അത് സ്വയം ഒരാളെ കൂടെ കൂട്ടി നിർത്തി make a team. That is very, very important. Interact with the parallel medical school, integrate with the relevant concepts of the field of physical medicine without compromising our basic concepts. Relevant concepts ഒരുപാട് വരുന്നുണ്ട്, പുതിയ പുതിയ കൺസെപ്റ്റ് ഫിസിക്കൽ മെഡിസിനിൽ. അപ്പോ നോൺ സർജിക്കൽ ആയിട്ട്, അതായത് നമുക്ക് കൺസർവേറ്റീവ് ആയിട്ട് ട്രീറ്റ് ചെയ്യാൻ ഒരുപാട് മേഖലകൾ വരുന്നുണ്ട്. അപ്പൊ അതെല്ലാം പുതിയ യങ് ഗ്രാജുവേറ്റ്സ് ആൻഡ് പോസ്റ്റ് ഗ്രാജുവേറ്റ്സ് ഷുഡ് എക്സ്പ്ലോർ ആൻഡ് ലെറ്റ് ദിസ് institution be a platform for that one and make a team. ഒരു ടീം ഇല്ലാതെ ഒരു കാരണവശാലും സക്സസ്ഫുൾ ആവില്ല. ഒരു വൺ മാൻ ഷോയിൽ ഒരിക്കലും നടക്കില്ല സ്പോർട്സ് മെഡിസിൻ. നോട്ട് ഓൺലി സ്പോർട്സ് മെഡിസിൻ, ഇനി നമുക്കറിയാമല്ലോ നമ്മൾ 4 പാദങ്ങൾ എന്ന് പറയുന്നുണ്ടല്ലോ. എങ്കിൽ പോലും സ്പോർട്സ് മെഡിസിനെ സംബന്ധിച്ചിടത്തോളം ഇറ്റ്സ് വെരി വെരി ഇമ്പോർട്ടന്റ് ദാറ്റ് യു മേക്ക് എ ടീം. വിത്ത് എ ടീം യു അപ്രോച്ച് with your ideology and logic and you will be successful. And this is my hospital. Next one. Thank you once again for your valuable time for attending my small session.
Thank you so much, sir. Now, I'd like to welcome Dr. Sudhikumar KB to honor Dr. Mathews Vempilly, founder, chief consultant, Vempilly Ayurveda Hospital, Muatupura, with a memento as a token of gratitude for his valuable time and this wonderful session.
Thank you.